Hi everyone, thank you for joining us to our fourth day of our 12 Days of Wellness series here at Ogden Clinic. Today we are going to be talking about the gift of no smoking. So for those of you who may have a New Year's resolution to stop smoking, stop vaping, all of those things, we hope we have great information for you today. But I'm very lucky to have Dr. Nathan Brown here today. I'm going to let him introduce himself, what he does, and where he's at.
Hi, thanks Carla. My name is Nathan Brown. I'm a doctor of osteopathic medicine. I work here at the Ogden Clinic on 12th Street, the Canyon View location. I'm a family medicine doctor, so we work with all kinds of different issues and problems, but one of the things that we love to try to talk to patients about is getting off of nicotine, tobacco, and other harmful drugs. So, happy to talk today.
Yeah, awesome. So we do have a lot of important things today, but we're just going to start off in talking about the health risks. I know a lot of people might set that goal for themselves to stop smoking, and now with the emergence of vaping and we see younger people doing these things, it's a lot harder for them to stop. So what are kind of the health risks of smoking, smokeless tobacco, vaping, from your perspective as a doctor?
Yeah. So, I think everybody's, mostly aware of a lot of the things that smoking cigarettes, a lot of the problems that causes. I think we learned it in DARE programs and as children and things like that. I think it's just important to go over some of the basics that all-cause mortality. If you're a smoker, half of the smokers that are consistent chronic smokers will die of a smoking-related cause. And some people like to say, well, I'm going to die of something. But most smoking-related causes aren't things that you want to die from. Unfortunately, those are the ones that tend to cause more prolonged and uncomfortable deaths. Things like COPD and the inability to breathe well for a long time and being tethered to oxygen tanks and unable to get and walk around. And people can live, for years in that kind of a situation. And it can be very uncomfortable and difficult. The leading cause of death in the United States is cardiovascular disease. No, not COVID. And cardiovascular is a third of those deaths are attributed to smoking alone. And it's between the nicotine and the other harmful chemicals that come with smoking tobacco. Those are just greatly increase those risks. But as a lot of the people still know, it's things like cancers, malignancy in general is greatly increased in many different cases due to smoking, increase of infections, things like pneumonia. Some can help. It can actually increase risk of diabetes as well, reproductive problems, pregnancy issues. People heal poorly. Many surgeons, depending on what kinds of orthopedic problems people have and surgeries they have to perform, sometimes they require patients to get off of cigarettes for a certain amount of time before they'll even perform those surgeries because of the delayed bone healing, and they don't want people to have a surgery and then not heal well from it. So there are a lot of those things just from tobacco smoking, and we a lot of people have been vaping more, which takes away a lot of those harmful chemicals, like the tar and things that we all saw, the black lungs, back in elementary school when they tried to scare us all to death. But there, while some of those health risks are decreased, just the presence of nicotine alone actually does quite a bit of damage. Just that idea of reduced healing, that's mainly because of nicotine. In addition, I've seen a lot of people try to use vaping as a way to get off of cigarettes, which it's worked pretty well for a lot of people, but I've seen some of them end up going off the deep end with that. And because vaping is so easy to do, it's easier to do around people. You don't have to worry. You don't notice if you're going through a whole carton or a whole pack in a day. You just keep pushing that button. And I've seen people just much more addicted to nicotine through vaping than they were through smoking, because it's so much easier to do and it's a little bit more fun, and then they have to worry about trying to get off of that as well. And we know about some of those lung issues that first started being investigated when vaping first started going on a rise, and those still do exist. So that's obviously another reason to be very careful of vaping as well. But in general, most of these chemicals that we take into our bodies harm it one way or another, and we should be very careful what we do use.
Right. all those things sound super scary, and like you said, you know, they're things that they have talked to us about since we're young. We're going through school, and they tell us all the bad things that can happen when we smoke. But even then, people don't tend to see those risks, or they don't tend to be scared enough to not smoke, and they continue to do it. But why is it so hard for people to quit smoking? Like people that do, you know, end up getting addicted, they might say, hey, I want to stop, but in reality, a lot of them can't do it as fast as they would want to. Why is it so hard for them to do that?
There are a lot of different reasons. I think whenever anybody has an addiction to a chemical, it's everybody has a little bit different relationship with that chemical, you could say. There are some people that, you know, just smoke socially, and they change jobs or change friends and they never smoke again. Whereas there are some people that, you know, as hard as they try, no matter what, it's, you know, they've always got cravings the rest of their lives. But some of the things that make it really hard for people are some of those social situations, stress. I know that, you know, there's some people that I've spoken with and they're like, yeah, I want to quit, but let's wait a few months because right now it's a really stressful time, you know, and I'm like, okay, so, you know, we'll bring it up at the next session. But that relationship with smoking, yeah, like I said, is very different. And some people I've spoken to some people like, oh yeah, I smoked for 30 years. My child was born. I decided to quit smoking and that was it. You know, and other people, you know, they've tried everything, you know, from going cold turkey to medications to other things, and they still have difficulty. And sometimes that's because of the other situations that they're in. Some people, they want to quit smoking, and they're, you know, like, I've been trying, you know, oh, but my husband smokes, and so he's always going outside or inside the house or whatever. Every time he lights up a cigarette, it's really hard for me to not smoke. And so those are some of the things sometimes we work with people. I'm like, all right, well, is your husband interested in quitting? Because you know, many times harder to quit smoking when somebody's there reminding you every 30 to 60 minutes that they're smoking still. So, I mean, there are a lot of different things for a lot of different individuals, and that's why it can be very beneficial to sit down and speak with somebody, whether it's your doctor or a therapist or something, and go over some of the, you know, what some of your difficulties are and see if there are ways to get over those. Because sometimes, sure, you know, Nicorette gum or, you know, patches can be beneficial, but if there are other things that are pulling you down, sometimes no matter how hard you try, you know, a social situation or something else might be your downfall.
Right. Right. So let's talk a little bit more about kind of those people that have said, okay, I'm going to decide to stop. I'm going to take that next step, either talk to my doctor, talk to a therapist about quitting smoking. I know a lot of the hardness sometimes comes from once they decide and then afterwards they experience things like withdrawal, a bunch of different other symptoms, and that kind of makes it harder for them. So what are those withdrawal symptoms that someone can experience after they decide to stop? Yeah,
so some of them, some people do really well with withdrawal symptoms. Other people, it's a big stumbling block for them. So obviously anybody who has, you know, had long-term access to this is going to have those nicotine withdrawals. And since and usually what people notice is sometimes a little bit of a shaking. Sometimes people have difficulty sleeping. They're very irritable. Some people will increase weight and due to an increased appetite. Nicotine is a bit of an appetite suppressant, and so when people stop smoking, sometimes they have that increased appetite and weight gain. And for some people, that's a big thing. And you know, they've quit smoking before, and they're smoking again. They're like, oh, I just know that if I quit smoking, I'm gonna, you know, gain 10 pounds again. And it is a difficult thing, and I don't want to demonetize, you know, all those other social factors that exist with smoking, but I mean, they know, and everybody knows, that overall health is probably more important, even though, you know, that weight gain isn't something very desirable. And so that's another thing that sometimes requires a little bit of help, sometimes from doctors, therapists, things like that, to either help with weight loss plans or you know, finding that, you know, that good self-image for who they are right now. But yeah, that's kind of mostly what people tend to deal with. But I mean, there are benefits, such as, you know, you don't stink. I've had just a couple weeks ago, I had a woman come into my office, and she was in her 30s, and she said that her son came home from school after like a red ribbon program or whatever, just crying, and she's like, "What's wrong?" And he said, "Mom, I know what happens to people that smoke. He had seen all those pictures, and he was just so sad that his mom was going to die early or have these problems. And it really hurt, kind of touched her. And she's like, that's kind of the reason I'm in today. I'm doing it. She's like, I've been meaning to quit for a long time, but right now it's for my son. I talked to her, and she's like, yeah, one of her issues is that her husband does still smoke. And so, we had to talk about that and kind of navigate, some of those issues, because, it's, everybody's a little bit different. Sometimes they need a bit of a tailored plan and some support one way or another, because it's a difficult thing.
Right. Yeah, I think, if you have someone in your life that smokes, or you've grown up with someone, you know how it affects all your family, not just the person that's smoking. So that's a really interesting point. Let's talk a little bit more about if someone does want to come and, talk to their doctor, if it's you or someone else, what are some good questions that someone would need to ask, either medication or just what to expect or how to start, all of those things?
Yeah. I think it's just important to know that it's going to be a back and forth discussion. When people come in and when they say they're interested in quitting smoking, the first thing that I want to know is your history. How long have you been smoking? How much do you smoke? Have you cut down? Why are you suddenly decided and interested in quitting smoking now versus other times? Have you tried things before? Have you tried cold turkey? Have you tried gums? Have you tried patches? Have you tried any medications? Do you know anybody that certain things have worked for? And just kind of putting a lot of those things together helps us kind of get an idea and kind of plan something for you. Some people are like, oh, my best friend used Chantix and it worked really, really well. And so then they've got this positive idea about, hey, this could actually really work because they've seen it work with other people. I've heard other people come in and be like, oh, I don't want that Chantix. So-and-so had a problem when they took it. And so then they have a natural aversion to that. So we usually start somewhere else because, as we know, a lot of this stuff is a little bit psychological. And so knowing where you are, what you're willing to do, what you have done is kind of the best thing you can bring to that table, and just that willingness to find the right way to quit.
Absolutely. Let's talk a little bit more about what, I think it's often hard for people that do smoke to kind of take that first step, either going to a doctor, asking for help. What can the people in their life, kind of do to help? So their family, like you mentioned, the kid coming back home and telling their mom, I know what's going to happen to you, so please stop smoking. And I think, if you've been in that position where someone, it's a very hard feeling knowing that you can't really do much. And it's often, kind of frustrating to know that. But what advice do you have for like family members, either to support the person in their life that does want to stop smoking, either to get them to come to a doctor or just in general providing that support?
Yeah, like you said, I mean, the big word is just support. There's only so much you can do for somebody else, but just knowing the support's in their corner makes a really big difference. Half the time when people come into the doctor and they say, oh, my wife made me come in, or oh, my husband's tired of me complaining about my shoulder pain. So just, the presence of somebody like a loved one in your life, being that squeaky wheel, like, hey, you said you were going to do this, are you going to do it? Or saying like, hey, you said you were quitting smoking, and I know where we're going is going to be, like this, are you sure you want to go? Or, for those who are smoking, one of the best things to do is to quit at the same time. That social support is huge with people that need that help, because they're going to have the times when they are going to have some withdrawals or some cravings, and if you're there to give them another cigarette, then it's going to be a lot easier for them to restart, and then the next time they're going to try to quit, they're going to be like, oh gosh, I failed last time, and they kind of lose some of that momentum and some of that positivity.
Absolutely. Yeah, support is a really big thing for a lot of things in life, but especially in moments like these. Let's just go back and talk a little bit about vaping. I know we might have some parents watching us, and I know that's been kind of a rising concern in the past couple years with more and more teens kind of vaping and not really understanding what long-term effects that could have in their life later on. I know it seems cool, it seems fun, everyone's doing it, you want to kind of fit in and all of those things, but what advice do you have for parents if they do have a teen or someone they know that might be vaping already at a young age?
Yeah, I mean, that's hard. It's me trying to give parents advice for teenagers. But I mean, honestly, a lot of it just ends up being, again, just like a positive support. being a little bit of a squeaky wheel. You can set some boundaries, saying like, okay, well, I can't stop you from doing what you're doing, but these are places you can't do it. And these are situations that you can't do it here. And at least they know, what things are accepted, but in the home or outside of the home or whatever. And that, boundaries are laid. If there are no boundaries, I guess if you don't care if your kid's vaping, then, I guess this part of the discussion isn't for you. But if you care, then they need to know that you care. And then once, if it is just a fad for them, once the fad part is over, they feel more supported. No, I told you so's, no, it's about time you got off that stupid thing. Positive support and, being positive about everything. That I think as long as your children know that you love them and, you're there for them regardless, they'll, once they're ready, they'll hopefully respond to some of the things you're saying and doing for them. So.
Right. And in regards to like vaping, does it have similar effects in the long term like smoking? I know that's really why people do it, because they say it causes a lot less damage than, smoking an actual cigarette. Do you see similar things like occurring later on in life as you would with smoking?
We don't have enough data, I don't think, for that yet as one of the issues. Vaping's only really been on the rise over the last handful of years, and it's only been around for, I don't know, like a decade or so, really. And, a lot of the long-term effects we've found from tobacco, smoking and things like that have been, over decades and decades of research and studies. We know that a lot of the chemicals that exist within tobacco aren't in vaping, but, there are other chemicals that are being inhaled. And like we mentioned, with even just nicotine alone, can cause a lot of problems other than just withdrawal symptoms and cravings, and jitteriness and anxiety, but as well, decreased healing in different ways and things like that. And you get addicted to something and you're stuck with it. There's certain places that don't allow vaping. There's certain places that, so you end up being addicted to something that you can't take everywhere with you, and you end up having some degree of problem. But I'm not going to say that we know it's just as bad as tobacco smoking, because we don't. But 100 years ago, there were doctors that said smoking was good for you. So be very careful on trying, putting new chemicals into your body that haven't had, any kind of good research done.
Awesome. And how can someone come and visit you? Let's say if someone saw this today and they were like, you know what, I'm gonna stop today and I want to go talk to Dr. Brown. How could they schedule an appointment with you, or?
Me or any other doctor. Either call the clinic, call scheduling, and when they ask, what do you want to see him for, smoking cessation or stop smoking, and then whenever the doctor sees that on their schedule, they're gonna have a little smile on their face and like, good, it's gonna be one of those easy appointments where, or at least where we're both talking about the same thing. I don't have to try to convince you to do something. We're already on the same page, and we can spend the entire time trying to come up with a good plan. And I can't imagine any doctor out there is sad or frustrated to see somebody come in. So I imagine it's a more positive appointment than many of the other ones as well. So
awesome. Yeah, if any of you watching, if you know someone or you can think of anyone that you would like for them to stop smoking, or they want to stop smoking, we'll leave Dr. Brown's information down in the comments of this live so you can schedule an appointment with him, learn a little bit more about what he does. So make sure you keep tabs on those comments. But we're going to open it up for questions if anyone has any questions. If not, make sure if you watch this later on in the day or you watch it tomorrow, whenever, feel free to leave the comments down below and your questions, and we will make sure to get in touch with Dr. Brown and he can answer those as best as he can. Do we have any questions in the comments?
No, I have one, if I may. My father stopped smoking about 35 years ago. He said, nicotine, of course, there's an addiction, it's difficult. What he had the most problem with in his case was he didn't know what to do with his hands. His hands were always so busy with the cigarettes, and his lips. His mouth was always, and he was a 2-pack a day kind of guy. Would you have any advice for someone? That was his biggest hurdle. If you talk to someone who had a similar hurdle, what kind of advice would you give them?
Yeah. So I've heard people replacing with, you hear like gum, like people want to do something with their mouth. Some people, just like bubble gum, even if it's just like, actual bubble gum. It's not just like mint flavored stuff. If you need to blow bubbles or whatever. Gum works pretty well for a lot of people. Other things that you can choose, some people, sunflower seeds and stuff like that. Fingers, it just depends. I know there's a whole bunch of those little like doodle devices and stuff these days, whether spinners or whatever. But I'm finding something that's kind of, some people can like pen tricks with their fingers. There you go. Google something, find a YouTube video on how to twirl your pen in your fingers. And that's, just small things like that that'll kind of get your fingers busy. And usually stuff like that, as long as you just got it going for a month or two, just long enough for you to change that habit. If you're used to fidgeting with something else in your fingers as opposed to a cigarette, you develop a little bit of a habit. It'll kind of overwrite the other one a little bit, and won't be quite as difficult as it used to be. So I mean, it's not something you have to stick with forever. To find some other annoying habit that's going to bother you and other people for the rest of your life, as much as just for a few months while your body kind of gets over that. When you bring up your father, quitting smoking 35 years ago. So quitting smoking, I mean, it's important to do. The earlier you do it, the better. They find that people that quit smoking before the age of 40, have far fewer long-lasting effects than those that smoke beyond 40. And even then, even at the age of 60, they find the people that quit at age 60 or even after usually die later than their peers. So there's still benefits from smoking cessation at any age. Especially sometimes when we see people come in and they are on oxygen. Number one, it's an explosive hazard, which I've actually seen, in clinic before, people coming in with burns because of oxygen explosions from cigarettes. But in addition, it continues to make things worse and worse. And just quitting smoking, just after a few months, people have significant improvements. So if you're out there and you're smoking, now's a good time to quit.
Yeah, it's never too late. Absolutely. Well, that's all we had for you today. Again, if you have any questions or if you watch this video later on, feel free to leave them below in the comments. But thank you so much, Dr. Brown, for all the information you gave us. And again, like he said, if you have someone in your life that does smoke and wants to stop smoking, support is the biggest thing, and encourage them to, either see their doctor, watch this live. I mean, that's a small step someone can take, but it's at least something, and it provides them that support and that initiative that you might want them to take. So thank you so much. Again, we'll leave his information down in the comments below, but thank you.
Yeah, you're welcome. Happy to be here.
Awesome. Thank you, everyone.